Okay, my name is Beth Shinn. I've been here this is my 5th year, and I'm a faculty member in Human and Organizational Development, and I'm currently taking a turn as department chair. Well, I was 30 years in a psychology department before this, and what really attracted me to HOD was that it was an interdisciplinary department, one that didn't frown on applied work, one that allowed you to integrate work across disciplines and to get out in the field and do work that might have an impact. All of us engage in both research and teaching, and so that's part of my job as well. I've taught at both the undergraduate and the master's and the doctoral levels, and I'm centrally also focused on a research program having to do with homelessness. In the community, I'm engaged more nationally than in Nashville. In Nashville, I've worked a little bit with the current Commissioner of Homelessness, and I've recently been appointed to the Healthy Nashville Leadership Council, which is supposed to guide the efforts of the Department of Health focused on health for Nashvillians. Nationally, I've worked with New York City and its Department of Homeless Services, a little bit with New York City's Department of Health, with Alameda County, and the continuum of care. At the national level, I've worked with the Federal Interagency Council on Homelessness and with some advocacy groups like the National Alliance to End Homelessness. I've been working in the area of homelessness for almost 30 years. Well, as homelessness began to spill out of the Boweries, of the Skid Rows, and onto the streets, I was in New York City, and it spilled out earlier in New York than it spilled out in many other places. Seeing our fellow citizens on the streets with their bags, with their clothing, was something that was a central concern. And I also had young children at that point, and they were saying, you know, Mommy, why is this person sleeping on the street? And how do you answer a child with that kind of question? And at the time I had a choice of, I'd been working in another area, and I got approached by 2 different groups, one working on HIV and one on homelessness, and I had to choose one or the other. I couldn't really devote the time to both, and I figured, well, HIV will have a vaccine in a couple of years, that will go away. The poor are always with us, and homelessness was going to be around for a while, or poverty was going to be around for a while, and homelessness is basically a manifestation of poverty. So I chose to get involved there. I often think of myself as kind of non-disciplinary social science. That is, I'm trained as a social and community psychologist, and I sometimes use tools and theories from those disciplines, but homelessness is not a psychological problem. It's a sociological problem, it's an economic problem, it's a political problem. And so confining oneself to any one discipline means simply not understanding the ramifications of an issue. And so it's really important that work on a problem like homelessness be able to draw on the strengths of multiple disciplines and to work across disciplines. And so that's what I've tried to do. So what's wonderful about the Department of Human and Organizational Development is that we don't pay too much attention to what the disciplines are that people come from. And we try in all of our classes, in our teaching and our research, to draw on multiple disciplines. I don't need to explain to anybody why what I'm doing is psychology. Mostly it's not. And I have students who are similarly interested in and drawing on theories and methodologies that come from a variety of disciplines. So the challenges of incorporating interdisciplinary or non-disciplinary, multidisciplinary work have to do mostly, I think, with respecting people's different perspectives on issues and valuing the different perspectives that people have. And I hope we try to do that in HOD. I think the passion is one for social justice, that we're in a society with desperate levels of inequality, and we're in a society that doesn't have to have homelessness. That is, we have the resources that we could end it. Our colleagues in Europe have lower levels of homelessness than we do because of choices that they have made in terms of the social safety net, in terms of levels of inequality, and those are policy choices. They have to do with tax programs, they have to do with social benefit programs, and we could do likewise. We also have issues everywhere around the world, but also in this country around social exclusion. So it's not random who ends up with the short end of the stick. So discrimination in areas of housing, in areas of employment, in areas of wealth accumulation against various socially excluded groups. And you can think about traditional forms of social exclusion against racial minorities. There's similar patterns of social exclusion against folks with serious mental illness, for example, who can't accumulate wealth and keep their Social Security benefits, who can't get employed for very many hours a week and keep their disability benefits, and who therefore are excluded from moving on to society and are overrepresented in the ranks of the homeless. So I guess what drives me in all of this is trying to say we can do better by our fellow citizens to bring everybody into some level of reasonable life. That's not saying it very well. We can do better in trying to give everybody in the United States and in Western countries generally a reasonable quality of life. We have the resources to do that. We're just not choosing to do that.